In this lecture, we're going to be going over some of the aspects of training and competency in the laboratory, not only how and why it's done, but also what is required of us by NACLS and some of the other regulating agencies. Pardon. So there are specific training requirements, as you are well aware, for the medical laboratory science as set out by NACLS. So you can't just go, as you guys know, you can't just go get a biology degree, show up at a lab and say, I think I know enough, why don't you hire me? NACLS requires that there are prerequisite courses. There are 5 areas of clinical study. So basically, as you guys are more than well aware, the prerequisite courses that NACLS requires are in biology, chemistry. You had to have math, remember the statistics. And those are going to provide a foundation for the clinical areas of study that are eventually going to be covered, as you guys understand. The curriculum that is set up is defined by NACLS. It must address not only the analytical stuff that we're going to do, but there's the pre-analytical, the post-analytical, all of these components of laboratory studies. So it's not just the methodologies or how you do the test. It's also the problem solving, and that's one of the things that delineates a medical laboratory scientist from the other people that work in the lab. Troubleshooting, interpretation of QC, clinical procedures, results, statistical approaches to data evaluation, as well as the quality assurance, the quality improvement principles that have to really guide us in the laboratory. All of this is part of what makes you a medical laboratory scientist and not a technician, okay? Specifically, the program curriculum has to include scientific content, not only in clinical chemistry, hematology, hemostasis, immunology, immunohematology and transfusion medicine, microbiology, of course, urines and body fluids, you guys did that, but also then the lab operations. Don't forget the lab operations. Then your not just the safety, but also how it's applied, application of safety, also government regulations and various standards of deemed organizations, how they apply to the clinical laboratory. And then we also are required to include principles and practices of professional conduct, which includes everything from continuing education to management to the laws that are involved in the laboratory. The idea is that medical laboratory scientists can become managers and the leaders in hospitals, so they need to know those things as far as to move up into the administration areas. Obviously, communication is important. Communication not just between laboratory scientists or between the scientists and the doctor, but even with the public, with patients, pardon me, and the other people that we're going to come in contact with, reference labs, IT people, everybody, even something as simple as the cleaning person. How do you get through the things that you need done, the way that you want things done? The communication's important. How it's done, when it's done, and how it's recorded. It's very important to keep records of those communications in the hospital. And then we do require that you go through some of the educational methodologies as well as being able to understand the clinical study design and implementation. In the lab sciences, most of what we're really interested in studying for our purposes is what other people have done. Was it a well-developed study? Can I trust that the study that was involved in the development of such and such kit or instrument or new procedure, that it was a good study, I can rely on it, I can do my own study and maybe use that procedure. Now, one of the things that is covered in um, in the lab operations point of NACLs has to do with how people learn. And one of the reasons that it is covered is because you're going to have to teach people literally maybe next year when you're working. You'll have next year's students coming through and you might be in charge of teaching them something. So understanding how to teach, the basics of how to teach, how people learn, was important to NACLs, and so they included some guidelines or some background, I should say, into that. And one of these is Bloom's taxonomy of learning, which was created in 1956 under the leadership of an educational psychologist named Dr. Benjamin Bloom, hence the name. And the idea was that he wanted to promote higher forms of thinking in education, in the field of education. He wanted to allow people to analyze and evaluate concepts and processes rather than just remembering facts. So he wanted to move away from rote learning and into more of a process in the way that we educate. And so Bloom's taxonomy of learning is used most often when we're designing either educational material, but also training material. So if you are tasked with designing something to train your fellow staff, some kind of training procedure, maybe you have to train phlebotomists on how to collect a new specimen, or maybe you need to train nurses in how to collect a specimen. Maybe you need to train your fellow technologists in how to perform a procedure. How do you develop that? You don't just walk into the room and say, this is how I do it. You need to have some kind of mechanisms. In order for the learning, how do you know that they actually learned it, to be proven? So Bloom's taxonomy helps us to cover each of the areas of learning so that we can develop an educational modality that will apply to each of those levels. So in Bloom's taxonomy, it says that there are 3 domains of learning. You have the cognitive domain, where there's some kind of knowledge that you need to impart. These are usually mental skills. So this is going to deal with the application or the analysis, synthesis, whatever, of the knowledge that you're trying to transmit to your group. Okay, so this is the background, the building blocks upon which everything else is going to be leaning on. Then the next analysis, the next domain of learning is affective, and this has to do with the growth, like an emotional or a personal attitude towards learning. So this has to do with the attitudes and interests that attach some kind of value, some kind of worth to the situation that the learner finds themselves in. So in other words, you're going to impart knowledge, but the learner has to be able to impart some kind of value, has to apply some value to that knowledge. And that value, or this affective domain, the increased value is associated with increased learning. If this is considered important, valuable by the learner, they'll tend to spend more time on that fact or whatever it is you're trying to impart. And then there's the psychomotor domain, and this is really the physical skills, the motor skills that are required to perform the task. So you have three separate areas. What is it, the knowledge that you're trying to impart? How valuable is this knowledge? Because that's going to tell your learner how important it is to learn this. And then exactly how physically is the learner going to apply that knowledge to a particular task. All of these, if you look at the new version here, the picture that they have here of the new version, with this chart here that I'm showing you, those three domains have been sort of amplified, and you can see that as you move through the process of learning, you go from remembering to understanding to applying. You're still not done that even after the first time that you've done something. So somebody tells you, this is what I want you to do. When you start to perform it, you're remembering that they told you to do something. The next step will be understanding why they told you to do something, applying that understanding to the task that you're doing. So it's not just, you make your bed every morning, you make your bed every morning, it's a habit, but applying that, why do you make your bed every morning, cleanliness and all that stuff, and then analyzing, evaluating, and creating. The farther you go up that ramp, the more the person has been able to learn, the more they've applied, more value obviously, that they've applied to that particular task. Obviously, we want our technologists to move as far up on this triangle kind of thing that they have here with each task that we're given. You may remember exactly how to do a push slide. And I'm sure you're very far up on being able to do a hematology push slide. Could you create a new, better way, create a training platform that would apply to that particular task? And that would cover all of those different levels. Knowing how to do it, understanding how to do it, actually doing it, then looking at what you did, making sure that it is appropriate, and evaluating how well it was done, and if necessary, creating a new way potentially, or a better way to do it. Now, when we teach people how to perform these tasks in the laboratory, unfortunately, it's going to come along with some kind of performance assessment. And now we're going to cover performance assessments as if they come from the supervisor, because they do. That's the reality. As you go through these clinical rotations, their assessments are coming from your managers, your supervisors, your educators. They come from me. But the reality is you should be able to assess yourself to a certain extent. Hopefully you know what kind of job you've done for the task that was set in front of you. Now, performance assessments, as a general rule, there are pros and cons to them. Okay, obviously there are immediate disadvantages. Obviously, they can destroy initiative. If you always think you're being judged on everything that you do, sometimes you don't want to do new things because you don't want to be judged on them. You don't want to be assessed on them. Well, that doesn't get you moving very far. Okay, it tends to destroy competitiveness, or to encourage competitiveness. So it's like, I do that better than you do. I know I'm going to get a better assessment than you do. All of those things come into play. And while competitiveness, depending on who you ask, that might be good. For some people, competitiveness will discourage their performance. And it's important to know who you're working with. Is competitiveness good or is it bad? It also does produce stress, obviously, when it's time to go in for your assessment. It's not necessarily a fun thing. Even just finding the time to go in and do it can be stressful. And it does require a financial investment on the part of your employer and on the part of everybody here, okay? And it will consume time, okay? Not just for you. You have to take time out to go in and receive your assessment, but the manager has to put it together and make sure that it's fair and generated well. There are, however, many more advantages to these assessments. And you can see the list of them there. You can read them all. It makes it clearer for each individual employee where they need to improve, where they're doing well, those kind of things. Okay. Now, assessments as a rule, and assessments are guided by NACLS. NACLS has their rules about how assessments should be performed, the minimum standards. And they have to include not just formal assessments that I'm sure you've had before, where things are checked off or numbers might be applied, and you have to sign off and say you either agree with the assessment or maybe you have a difference of opinion. There also has to be some kind of informal appraisals. Informal appraisals where the manager or supervisor is allowing the individual to have a chance to improve their performance before the formal assessment occurs. Okay, that allows what NACLS is trying to impose there is some kind of form of teamwork between the employee and the manager, so that the formal assessment isn't just a routine kind of, okay, come in, this is your yearly checkup, here's where you stink, here's where you're good, I'll see you next year. There needs to be something where communication occurs throughout the year in an informal manner, so that the employee has a better chance of improving. So there has to be also some, all of this stuff has to be written down. You can't just go into your supervisor's office and have, an attaboy moment and then and move on. All of it has to be organized. It has to be, a procedure has to be written. All of this stuff has to be very clear as to what's expected of the person who's doing the evaluation, what's expected of the person who's receiving the evaluation. Okay, so these have to be all written out. Procedures, procedures, procedures. It also allows, if you get a new supervisor, they know how your evaluation was done in the past. Okay, this will also require, if you're going to do an evaluation, there has to, before that's ever done, there has to be a well-written, well-defined job description to make sure that you meet that evaluation, okay? So that it's hard to say you're doing a good job if you don't actually know what you're supposed to be doing. So the job description has to be well defined, and the employee has to be aware of it before the assessment ever occurs. And then, of course, expectations should be established for the employee. This is what I expect you to do over the next year, learn and become proficient at, okay? And it's supposed to, the assessment really should be just about what the employee is doing as far as their job. You can't include personality traits or anything like that, Well, you do your work really well, but you're really grumpy all the time. That's not really appropriate for an evaluation, for an assessment. The assessment has to be based on those skills that you learned, those tasks that you learned, okay? Now, saying somebody's grumpy just refers to their personality. Saying somebody does not work well with others, that's a different thing. That's part of your job as well. Okay, so it can't get personal as far as your personality trait, but it can affect, it can include personal things that go on in the lab. And then NACLS does require that the assessment be shared with the employee, and the employee should have their own opportunity to add any comments, any evaluation of their, own, what they think, how they think they do. And NACLS also requires that this has to be done consistently. So you can't have an evaluation only when JACO's coming. It has to be done on an annual basis. Now, again, nobody likes to receive an assessment. It's not exactly a fun thing to do. Even if it's good, it's kind of, embarrassing. You go in there and say, talk about yourself for 20 minutes. But it is required, not just by NACLS or CLSI. It's required by JACO. JACO is one of our overseeing agencies, and this is part of their quality improvement measures. They expect assessments to be done on all levels, and those should be available for JACO. If JACO comes in and they say, I want to see how you assess people, you have to bring out the procedures and explain how you do it, and then show the results of what you're doing. And one of the big things is that while the assessment is good, you have to look at the feedback from year to year too. So your first year assessment is going to be pretty simple. This is what I think you need to improve on, and we'll go forward, or this is what I want you to learn, and going forward, that's what I want to see. The second time you get assessed, it should say, you know what, you're not really learning this, or you're doing a very good job on this, I'm going to add more. You know, you have to see some kind of feedback as we go from year to year. That's what JACO wants to see. They're looking at the clinical needs. They're saying, okay, are all the tasks being accomplished in your laboratory? What new tasks are you going to need as far as lab expansion or improvement goes? And who are you going to apply to that, and why? Looking at the assessments that have been done on the employees, this is why we chose so-and-so to expand our, you know, coagulation department and improve our, you know, online connection, whatever it is. And this allows not only the lab to improve, this is what JACO wants, they want the lab to improve. Expansion not necessarily required, but they definitely want to see improvement. And it also, JACO wants to see employee development. They want to see how the employer is interacting with the employee. They also will be in charge, or I'm sorry, they will influence the elements of your formal appraisal. Okay, so there are certain things that are required to be a part of your appraisal when you go in there. There have to be very clear expectations, and those have to be based on the mission statement. Your lab does have a mission statement. All labs have to have one, although it usually does belong to the organization. So, but there has to be an mission statement. You should know what it is. JACO on their inspections can come and ask anybody, what's your mission statement? Okay, the goals and the values of that mission statement have to be reflected in how the appraisal is developed. Okay, and remember, where's our first step for evaluation? It has to start with that job description. That job description has to be written down. It has to be established for each layer in the laboratory. It starts with a title, so medical laboratory scientist, and usually there's, like, you know, level 1, level 2, whatever. So level 1 would be maybe your beginning or something like that. It has to define which department you work for. There's usually some kind of number or code that would be included in that. It has to state whether or not it's full or part-time. And then it does have to have your job summary. So we're talking about, what are your essential functions? What is your level of authority? What is your reporting relationship? Who reports to you, and to whom do you report? What are the skills or traits that are required to perform the tasks, those essential functions that you had? You know, do you have to be computer proficient? Do you have to, in your case, you have to have a license. So that's one of the essential skills and qualifications that are going to be required. Okay. Are there physical requirements? So that is going to have to be established, because then if somebody doesn't meet those physical requirements, they obviously would not be considered acceptable for that job. So when we're talking about physical requirements, being able to you know, work the machine. The machine is, if there are buttons on the machine that are 6 feet tall, there has to be some way for you to reach the buttons on the machine that are 6 feet high. It could include some kind of assistance from the hospital, which may be a ladder, a step stool, whatever, that's fine, but you still have to be able to reach it. You know, if somebody shows up and says, okay, I'm a licensed medical technologist, I just happen to have gone deaf. Well, is it a requirement that you be able to hear the alarms that are on the instruments? If that's a requirement, it has to be written in the job description. Okay. Effective date of job description. So when you have to have this job description updated, and that date has to be written on the job description. If you bring in a new instrument that requires new skills, then the job description has to be updated, and then the date will change. Okay, so that's why that date is important. Um, there has to be some kind of a valid and fair performance assessment. We're going to go through that a little bit on the next slide as well. But basically what we're talking about is, in order to be valid and fair, your supervisor, as a supervisor, you couldn't say to an employee, well, you know, you're just so difficult to work with. That's not really a valid and fair performance assessment, although it may be true. It's not valid and fair because it's kind of subjective. Maybe the person has difficulty working with you, but there's 6 other people that they could work very fine with. So we're looking for our measurable scale. So you are able to perform 50 tasks in a day when every other person in the laboratory is performing 150. Okay, well maybe that's a demonstration of poor performance. Those are something that's measurable as opposed to, you know, I just don't like you. That's not acceptable. So we're talking about maybe the number of tests that are done in a day. How about the accuracy of the test? We have to redo 10 of the things that you do every day, and we don't have to do that for other people. Or maybe we only have to redo 10 of your things, and everybody else we're redoing 20. So having an accuracy assessment is also important. And also following proper procedure. You never do QC, or you never record QC, and that's part of our procedure. You don't call in critical lab results properly, or you do, but you do it by a different method. You have to make sure that the employee is actually following. These are measurable things. This is our procedure. This is when you didn't do it. That's a fair and valid assessment mechanism. You also then have to provide for the employee a plan for improvement. You can't just say to them, you need to do better. You need to have a plan. I'm going to be watching how many tasks you do and figuring out how, and we're going to figure out together, how can I provide more time for you to get these tasks done faster? I'm going to sit with you and evaluate what you're doing that's taking longer. Whatever it is that the supervisor has to come up with some kind of plan to help that employee improve. And someday you're going to be the supervisor, so you have to think of these things. And then there has to be a follow-up. So here's my plan for you to improve, and I'm going to follow up with you, not next year, that's too long. I'm going to follow up with you in a month, and we're going to look at how you've improved. And then I'm going to follow up with you in 6 months. And so on. And so the plan has to be established in advance. You can't just suddenly show up next week and say, you know what, I've been watching you for a week, you stink. You know, that's not allowed. Okay? The plan has to be out there for the employee so that everybody's well aware of what they're supposed to do. If the employee then has a plan and the supervisor never comes back, well, I guess it's not that important. You know, that there has to be some mechanism there. Now, so what can the plans be? How can I assess you? Can I just say, well, I don't think you do enough a day? Or how do I have to look at what are these measurable things? So there are 2 mechanisms of assessment. There's criterion referenced assessment or norm referenced assessment. So with criterion referenced assessment, we're comparing the individual to some kind of standard or benchmark, which has to be reached by every individual. So for example, you take an exam, the exam is out of 100. Okay, so that's your criteria. You want to reach 100. In the laboratory, for example, if I give you a batch of samples to complete, and I tell you I need these results in 20 minutes, then the criteria is you need to do these 12 samples that I give you in 20 minutes. Okay, that I'm making sure that you perform a given number in a given amount of time. Some of the other things that might be criterion referenced in assessments, we receive, for example, the proficiency exams, and they're assigned to employees in the lab. Your performance on that assessment is then compared to the entire group, meaning every laboratory in the entire nation that performs that, and so we can compare your results against literally everybody. That's the criterion referenced. Also, we know the proficiency supplier knows what the results are. So we have that criterion, okay? This is different from a norm referenced assessment where the results that you provide are compared to the work of everybody else. So it's kind of like a curve on an exam. So yes, the exam's out of 100, but really we're just looking at what everybody did. Those who got the most right get an A, and we just apply you to a bell curve. Okay. In this particular case, what we're looking at is how the employee works compared to everybody else, maybe in the laboratory. So this might have to do with, you might use norm referenced assessments to compare the work of an employee in hospital specific tasks. So you don't stack when the order comes in of all of our new reagents or media or whatever it is, you don't follow what everybody else does in putting it away. You put it wherever you want. Making that would be norm reference. So we want everybody to do the things the same way, so that then I know where to find it. Norm referenced something like, you don't clean your desk as well as everybody else. Those are things that can be, you can compare the individual employee to the rest of the employees. If you don't keep a clean desk and everybody else keeps a clean desk, I would like you to behave more like everybody else in the hospital. It's hard to compare those kind of things to everybody in the profession, because not everybody's hospital works the same way. So you might use a norm referenced assessment to compare those hospital specific tasks. Okay. And then so you can see how these are applied to the actual task itself. Now, when we're looking at other appraisals, the appraisals that affect usually the laboratory on a whole, we're talking about things like competency-based appraisals. We don't let laboratories get their certification and then just randomly let them do their work and never assess them again. Usually we do competency-based appraisals laboratory-wide, as I spoke before about. You get proficiency exams that come in, for example, and those proficiency exams are to test how the procedures that you have at your lab function as compared to, it's a criterion-based assessment. How do they work as compared to the procedures performed by every other lab? Okay. So these have to take into account literally everybody in the laboratory. You can't have a special person to just do the proficiencies, the competency tests, these proficiencies that come in. They must be spread out across the laboratory so that you are doing two things at the same time when these proficiencies come in. You are testing not only the laboratory's procedures and making sure that those procedures compare well to the rest of the laboratories in the profession, but you're also testing the individual and making sure that they perform the procedure properly. For example, you get in a proficiency for chemistry tests, and you have, say, 5 different chemistry tests that you need to be done, it's perfectly legitimate to assign them to 5 different people. That way you're testing 5 different people to make sure that each of those 5 people perform the test appropriately. You can even give those proficiencies to 5 different people, and anonymously you assign them. Make sure that those 5 actually turned out the same, and then you're looking at them and saying, okay, we did them all the same. This all has to be anonymous. A technologist should not know. They always do, but they should not know that they're working on a proficiency. Now, the proficiencies come not just from CAP, which is the College of American Pathologists, but also, which is our standard, but also the state. New York State does send in proficiencies. They expect us to complete them, and those proficiencies will be based on the licenses that we hold. Okay. Now there are advantages and disadvantages to the proficiencies. Now the advantage, certainly you get a true idea of how the employee and the hospital perform the job that we're asking to it. And it gives you a measurable standard to let you know how are we doing compared to everybody else. Okay. Um, it also gives you an idea of, oh, well, wait a minute, we're not doing very well on this test. We keep failing. Well, you can't really keep failing this test. You'll lose your license. But we failed this test. Maybe we need to improve our procedure. Okay. And it also, because when you do fail a test, you have to, it actually becomes trackable, and CAP or the state will be looking at how you perform on the next proficiency that you get in. Okay, and so seeing an improvement there is demonstration that you actually address the deficiency, and that you improved your procedure wherever it went wrong. Okay. These also, one of the things that applies to these is this little sketch that I have here for you, which is Miller's prism of clinical competence, okay, or Miller's pyramid. And what we're looking for here is it is really the total. If we're looking at the total laboratory, how does it apply knowledge and experience to the tasks that it's performing? Okay, so it starts out with knowing how to do something, knowing the facts, right? Knowing the theory behind the task. Then how is that theory actually performed? What's the application? Knowing how we're going to take that theory. Okay, this is the chemical reaction that we're looking for when we test for glucose in a blood. How are we going to apply that? Now we need to know how, the second level of the pyramid. So how are we going to apply that chemical reaction in our instrument? Well, here's the reagents. They're going to be added to this cuvette. I'm going to add the specimen here, and the reaction is going to occur in this way. You're going to then show that you can do that, whether it's through some kind of simulation or actually performing the test with observation. So you're going to show, I know how to perform this procedure that I learned the basics behind. And then you're able to integrate, you're able to perform that on a daily basis without observation. This requires not just skills, which we can see, also an attitude, a confidence that you can perform the test and be confident in the results that you're getting. Attitude, skills, as well as the knowledge that you're hopefully learning here in Marist. Okay, so when you have completed a competency-based appraisal, we know that you don't just have the background knowledge, that you can actually, you've reached the highest level of Miller's pyramid in this case. So what are the disadvantages of the competency-based appraisal? Well, one of the biggest disadvantages is that although it really shouldn't be this way, employees always know that it's a competency test. They always know that it's a CAP. That has to do with the fact that you have to label it properly. You need to know that it's, we do have labeling rules as well. So when you know that it's an appraisal, employees tend to treat it differently from patient samples. And that's a reality. And the reality is you always know it's there, because you saw it coming in the mail. I mean, you know that it's there. It's also on the calendar, and there's a big due dates, and it has to be written up. So employees do always know that it's some kind of competency test. And when it's a test, you tend to treat it differently. There's just nothing that we can do about that. It also will tend to build competitiveness, not just between employees, but it can build competitiveness between institutions, and it can cause stress. It will increase expense and time. It'll use up time and things like that. So those are some disadvantages, but the advantages definitely outweigh the disadvantages as far as competency-based tests go. Okay, so this also, the comparative also allows a manager to really specifically communicate those areas where the employee can improve, and gives the employee a benchmark. Okay, well, everybody else always punches in. Why can't I do that? And I guess I need to do that every day. Since everybody else does it every day, that's what I have to do. So that allows that. There are pluses and minuses there, of course. Self-appraisal is another mechanism rating system. It's usually done just by the managers. Of course, they don't want to be appraised. But once you get higher up in administration, usually it's self-appraisal. The interesting thing is they've done self-appraisal with all employees. They've done studies on this, and they find that the interesting thing is that employees usually rate themselves either the same or lower than a manager would have, which is interesting, especially the lower part. So I guess building up expectations about ourselves is something that we don't like to do. The peer-to-peer is where your coworkers evaluate each other. This is usually leads to just nightmares in the laboratory. It requires a whole lot of trust, and there's a whole bunch of fears and competitiveness that might really go crazy. It requires an enormous amount of training for anybody who's doing the evaluation, which is everybody. So the risk of conflict, this is not commonly used in hospitals. And then the 360 feedback, which is generally seen as probably the best way to rate your employees. It's designed to obtain a really well-rounded appraisal. But this 360 feedback is usually reserved for, again, management levels because it requires a lot more work. The evaluation is actually performed most often anonymously, and it'll invite constructive and in-depth feedback from all levels, whether it's your peers, your subordinates, supervisors, customers. So you reach out. So sometimes you're given, maybe somebody might reach out to you and ask you to how does your supervisor interact with you, and that would be used in a 360-degree feedback. It doesn't necessarily align with any goals that the institution might have for that particular individual, but it does give you a pretty well-rounded appraisal. It does require a lot more work, however. Now, the interesting thing is, as this competency requirement, which is it is a NACLS requirement, there actually was no requirement to assess competency in the laboratory before 1988. CLIA 88, which was the Clinical Laboratory Improvement Amendment of 1988, was the first time that we actually had an actual requirement to assess competency in the laboratory. Okay, and the CLIA, this is important because CLIA classified all of our lab tests, all of the commercially marketed lab tests, into 3 levels of complexity, and that becomes important for how we should assess competency. And those levels are, those 3 levels of complexity are either waived, moderate, or high level complexity testing. And what these different levels do are they define the qualifications that are required for the personnel who would be performing the tests, and it defines the mechanisms that the lab has to use to ensure that the people coming from all these different educational and training backgrounds can meet the federal regulations for these various levels of tests. So all labs, according to CLIA 88, all labs are required to have some kind of ongoing mechanism where they evaluate the effectiveness of the policies and procedures that they have in place, which is how you ensure competency. Okay, that's your competency assessment. Now, if you look at this this chart here, this one here, you can see that the laboratory, these are just the requirements for a laboratory director if you're performing moderate complexity testing. And what this is, so this is just the standard number that you ensure that policies and procedures are established for monitoring individuals who conduct any of the phases of testing to assure that they're competent and they maintain their competency to process specimens, perform test procedures, and report the test promptly, proficiently, and whenever necessary, identifying needs for remedial training and continuing education to improve skills. Those are what the laboratory director is required to do. Okay, and you can see that the high complexity testing is just pretty much the same thing. You still have to do all the same stuff. The technical consultant, pardon me, has to be able to evaluate the competency of all testing personnel and assure that the staff maintain their competency to perform that test accurately and proficiently. Who's the technical consultant? In most cases, that technical consultant will be your immediate supervisor. They're the ones who will evaluate your individual competency. When you come onto the job, your competency will have to be evaluated, and then annually after that, you have to demonstrate where your competency was evaluated. So CLIA 88 was the first time that we had these rules. Oh my goodness, well, we never had these rules that said that you actually have to ensure that the people that work in the laboratory are competent to do the jobs. You know, you can't just train anybody to do these tests. CAP then came along, which is the College of Pathologists, with a lab accreditation program, or LAP, which provides an inspection checklist with guidelines that address not just employee training and experience, but also includes performance reviews and competency assessment. So in the lab accreditation program, which that's where you come your CAP inspection, right? We get inspected on lots of things, how we perform our procedures, what the lab looks like, the physical space, all that stuff. Also included in that are, in the inspection checklist, are these guidelines. So we want to see what are your training procedures, how have you done them, how have you improved them, the experience that's required for particular tasks, the background, all of that stuff has to be documented, written up in procedures, maintained, and improved over time. Then in 1996, the Joint Commission came in, JCO, and put in place standards that had to be used by all hospitals to assess, document, and improve the competency of all employees. Okay, and so they added 5 aspects that some of them were covered by CAP and by CLIA, but the Joint Commission then came in. They said, you know, we want these as well. When we come on our inspections, these are the things that we want to see. And so they said that your assessments have to be job specific. That's where the job description comes in. They have to be job specific. They have to be measurable. They have to be demonstrated, meaning so you have to have some evidence that how do you know that Bridget doesn't know how to make a push smear? Well, here are these 5 examples here where the push smear was had to be repeated, and you show the task, the incidents where they were. There have to be age-specific competency statements. So as far as the employee ages in the spot, what is expected at that level. So beginning, moderate experience, increased experience, and so on. You also have to specify the responsibilities of management pertaining to the assessment and maintaining of employee competency. So what does the management have to do to make sure that the employee remains competent? So providing those competency assessment tests, your CAP surveys and things like that. Those are things that the management has to purchase because they're not free. That you have to purchase them and make sure that your employees are doing them. How do you can do in-house competency tests as well on top of that, and many labs do that. So and then you do also assessments where I pull up paperwork maybe on some specimen that you did, and I look at what you did in the computer to evaluate how you did that day. Okay. And then I also have to provide learning experiences as management for you. So continuing education opportunities, continuing education overview, making sure that you are doing your continuing education, and also some kind of evaluation for the basic standards, safety and all of that stuff. So this is an example of the checklist that CAP gives you. So these are not necessarily, it doesn't look like a checklist probably that you've ever seen before, but this is just a small portion of it, just to get an idea of what you might see. Okay, so in this particular case, you're seeing the what are some of the things that have to be maintained by the laboratory to ensure that that assessment, that personnel development and assessment is maintained. So in this first one, you can see that Gen 54400 requires that personnel records are maintained with all of the current technical personnel and that they include each of the following items. So a CAP inspector could come in and say, okay, look here, I have, you have an employee named Bridget Shanley. I want to see all of these 9 things: summary of the training and experience, academic degree or transcript, license if it's required by that state, which in New York it is, certification if it's required by the state or their employer, description of current duties, so that's your job description, records of continuing education, as well as any radiation exposure if available, work-related incidents and/or accident records, and dates of employment. I want all of those 9 things. I want you to produce them right now. And they can ask that on any employee that they come in technical, in this case, technical employee. Okay, and you have to keep, the supervisor, the laboratory has to keep those somehow on file. Okay. And then if you look down here, you can see that Gen 55450, initial training phase, there's documentation that you satisfactorily completed the initial training on all the instruments. Visual discrimination, you have to be tested for color discrimination. So you have to have a color test, okay? And then corrective action. If an employee fails to demonstrate satisfactory performance, what corrective action plan do you have put in place? And you move through all of these. The inspector will move through all of these and make sure that you have not just the procedures that state, okay, I have a procedure that states I need all of these things on every employee. Great, you have that procedure. Now let me see what you have on each employee, that you have to prove that you do it. Okay. And then there's other checklists. So for example, there are some of the checklists for determining, there are some skills, for example, that are required to be considered competent. So can the employee collect and label and process and transport and store specimens? Can they implement standard lab procedures? Can they perform the tests that I want them to perform? It's in their job description. Can they perform preventive maintenance? Can they troubleshoot? Can they calibrate? Can they understand reagent storage? Can they understand stability of reagents? Can they implement quality control policies? Can they understand the factors that are going to influence test results? So for example, the room gets too hot, the room gets too cold. These might influence tests. Can they assess QC samples? Look, the QC is out. We need to do something about it. All of these are required skills, and those have to be demonstrated on your personnel records that each employee meets these required skills.